People often ask me about our results in microvascular decompression surgeries for trigeminal neuralgia and hemifacial spasms. We have audited the last 20 years results, which puts them in excess of 99% success rate. We have performed more than 1800 MVD surgeries for trigeminal neuralgia and more than 750 for hemifacial spasms over the last 21 years time period. Some patients, especially those coming from foreign countries and those who are educated, ask me how these results are so good. You see, I am not bragging here, but I am trying to dissect the anatomy of creation of good results. And I ask myself, indeed, why the results have been rather extraordinary. Because we are all human beings in the end, and we are prone to similar shortcomings, and I am no different. So really, why? Why does this happen? I think the real reason lies in the emotional energy our team invests in treating these patients. I think that if you put yourself in patient's shoes whenever you are treating the patient, you understand the agony they are going through. Your inner mind somewhere urges you that you must try and end this agony. And this is what is so important. I think this empathy, this emotional energy works at some subconscious level to create good results. Of course, surgical excellence, surgical dexterity, top technology, etc. are all important without doubt, and they have to be there. However, the real source here that brings about the alchemy of giving good results is the empathy and the emotional investment of the entire team that is treating these patients. On the other hand, as a person, as a team, it is quite draining. I must admit that it is quite draining. It is especially draining psychologically. But without it, you cannot give good results. And I must say that when we look at a person suffering from trigeminal neuralgia and visualize the severe pain, the agonizing burning, the agonizing current-like sensations that come on his or her face due to trigeminal neuralgia, we all feel that pain somewhere within. And I feel that I need to do something about it. I need to remove this pain from this person's life. This basic feeling which comes within me and is born within me while talking to the patient finally leads me towards giving the results that we see today. Similarly, when I look at a person with hemifacial spasms and I put myself in the shoes of the person and I visualize myself how he must be going through while speaking with other people, how much shame he or she must be feeling, how much discomfort it must be causing, that gives me the real insight into the problem. And then it hits me, and then I feel that this person is suffering so much that I must use everything that is in my power to remove this problem from his or her life. Not only me, our entire team, starting from the counselors, surgical team, anesthesia team, post-operative care team, they have this emotional energy invested in the outcome of these patients. The power and the force of empathy is enormous. It sometimes, I think sometimes it is not appreciated as much as it should be appreciated. And to make this point specifically, I am speaking to you today. Thank you very much for listening to this, and please join us for our future podcasts.